Hi, today we have Dr. Teresa Sievers, and we're going to be talking about specific form arthritis because we get a lot of questions on that, and we wanted your medical expertise. And it's about patellofemoral arthritis and the causes. What are the causes of patellofemoral arthritis?
That's a very fancy word
for
osteoarthritis of the knee.
So that's what it is.
That's what it is.
Okay.
And usually it's a wear and tear. You know, we have this idiopathic. We don't know why people get it, but most of the time it's age-related, and it's age-related from a prior injury, or even it doesn't have to be a prior injury. It's wear and tear. If you're walking on these knees every day and bending, and you're 55 years old, you've been doing it for 50 years plus, you're going to get it more than likely. And it's very debilitating. There might be some mild swelling that the patient might feel, but usually it's just the pain and the stiffness. They can't go out and play their golf game or do their tennis like they normally do, and they're not moving. And that's a big problem because this sort of arthritis, you want to keep the person moving because they usually will feel better. But if they have such pain, they won't move.
Okay, I've never asked you this before, but is this age-related? Can you get it at a young age, or is it mostly for people that are a little bit older?
Actually, it can be both. It's really not just, I mean, people think of it as an age-related illness, and yes, it does typically, but we have a lot of people who train competitively, and that's a lot of wear and tear, and they can actually get osteoarthritis earlier than somebody who might be, 50 years old. So it's not just that.
So you can, so if you're 35, 40,
athlete,
you're the weekend warrior, you work out a lot, you do all that, you could get that.
Absolutely.
Okay.
Absolutely.
All right, and I notice you have a lot of joint supplements here at your clinic, and I take it you're a very big advocate of natural supplements.
I am, and particularly for osteoarthritis. I really can't stress enough how the drugs that we have available that have been approved through our FDA, they actually are just treating the symptom. It's not treating the root cause. It's not rebuilding that joint.
Like masking the pain.
It's kind of masking the pain. So what we're looking for is something that might actually possibly repair that joint and let them get back to movement so that they can go about and keep moving and have less pain.
Okay, and would something like Flexcin, for example?
It's very possible that something like Flexcin might help. And the reason is it's very unique because people pick up the bottle and they say, oh, there's glucosamine in that. That doesn't work for me. I use that. And I explain to them, well, the reason is probably because you didn't get that fatty acid in there, the CM8 or the cetyl myristoyate, which is actually lubricating the joint. It's calming down any inflammation that may be in there. And then it's allowing things like MSM with its sulfur component in there to help rebuild the collagen and the cartilage that's in there. And it also has the hydrolyzed collagen in it, which helps. And then it has the glucosamine in it, which is also rebuilding the joint. So it's got some other ingredients in there.
And I've noticed you have like a bright red, yellow, and then a red bottle for the blue.
So one is more of a joint loading kind of to get you going. We do anywhere from 2 tablets twice a day to 2 tablets 3 times a day, depending upon how severe it is. Usually in the beginning we might do 6 tablets a day like that for maybe 2 weeks. And then we can usually lower them down to twice a day for another 4 to 6 weeks, depending upon how they're doing. And then we might switch over to the joint maintenance. And
then, okay, so viewers out there are probably thinking, well, that's a lot of capsules for me. Could I overdose on that? Is that dangerous? I mean, you're recommending 6 capsules a day at one point.
Well, it's interesting. I was actually researching on the web, and there is another product out there that carries CM8 in it, and their dosing is 11 pills a day. 11 pills a day. And it doesn't even give you as much CM8. You can't overdose on it. It's not interacting with your other drugs. I know people heard me say the word sulfur, and they think, oh, I have a sulfur allergy. I can't take that. This is sulfur. S-U-L-P-H-U-R, not sulfa, S-U-L-F-A, which is what people have allergies to, which, by the way, a lot of the anti-inflammatories have that, and it is a contraindication.
Yeah, we've had questions like that about sulfa versus sulfur. It's a little bit of a confusion here.
Yep.
Okay, great.
Good.
Well, here you guys have it. Dr. Sievers, and thank you for your expertise.
Thank you.